Good evening, everyone, and I wanted to welcome you to our interview with Dr. Udani, and we're going to be talking about naturopathy and how it can benefit you and your health. So tonight I'm going to be interviewing Dr. Udani and get a little bit to know a little bit more about her as an individual and her background, but also a lot about what her practice is about and how it can have these incredible benefits to us. So please help me welcome Dr. Udani. So welcome.
Thank you so much.
You're welcome. So I wanted to kind of start off and maybe go back a little bit and just have our audience be able to understand what got you started into alternative healthcare.
Right. So I actually, from when I was young, I always wanted to be a doctor. So I wanted to go the medical doctor pathway. I wrote all my licensing, like the medical entrance exams, and I actually took a year off after my undergraduate degree just to work. And that's when my mother actually ended up getting ill, and she was having trouble navigating the traditional medical system and getting the relief that she wanted. So then she turned to the alternative pathway, and she really just took her health into her own hands and sought all these different practitioners out and really got well. So that made me look into this pathway and see, oh, there's actually this whole other world of medicine that I didn't know about before. And so I started on that pathway. I did the 4-year degree in naturopathic medicine, and it's actually helped my own health as well, because it's empowered me to kind of look beyond my symptoms and to see the connections. And so that's really what started me on this path.
Wow. So you got to see both sides of kind of the medical side as well as the naturopathic side. So how would you describe that they are different?
Right. So when you think about a traditional, conventional Western medicine, you really think about the symptoms. So you're addressing the symptom. Maybe when you go to a clinic, you really just tell the doctor the symptoms, and then they give you medication addressing that. They don't really go deeper into whatever is actually causing it. So for example, if you go with a skin rash, with an eczema, they would give you a corticosteroid cream and say, all right, this is it, like you'll be fine. But really very rarely is that very effective. So what we as naturopaths do is we first spend a lot longer with you as a patient, really seeing all the connections about your symptoms, connecting the dots. Where did it begin? What is the timeline? How is your lifestyle? How is your diet? How is your stress levels? What are the other medications that you're on? Because all of these have an effect on your health. And what we really promote is the healing power of the body, and using healing power of nature to bring you back to wellness.
Wow. So you're healing the whole body as a whole.
Exactly.
It's all interconnected, right?
Yes. So that's I was going to say, it was another difference between Western medical system and more naturopathic approach, is that we look at the whole body. We look at all the connections, and you see you as a person, and just not just a symptom.
Wow. And so what types of conditions do you actually usually see?
Right. So I see quite a variety, actually. I see patients coming in for fatigue, coming in for digestive concerns. A lot of patients come in for hormonal issues, so menopause or hot flashes, or they have really heavy periods, or sometimes they have trouble getting pregnant. I see patients coming in with pain, a lot of skin conditions too, because it's one of my focuses. And also mood issues as well. So anxiety, stress, sometimes depression as well. So all of these are really conditions, I would say, that kind of doesn't make you feel your best every day, right? And if you're looking to optimize how you're feeling, because you want to feel good every day, right? That's how we should be. Our health shouldn't be something that's keeping us away from feeling our best. So a lot of my patients come in with that goal, that they want to get better. They're just tired of feeling the same way, day in and day out, and they want to look at other options.
And what type of age brackets do you typically see in your practice?
So typically I see usually adults. I also see some children as well, some pediatric cases, especially concerning eczema or skin conditions. I most of my patients are women at this point, but I'm of course open for male patients as well. So right now it is a pretty variety of ages right now.
That's awesome. And what type of treatment modalities do you use in your practice?
Right. So in naturopathic medicine, we actually have a lot of tools in our toolbox. So we are authorized to perform acupuncture. We're authorized to perform spinal manipulations. We can prescribe botanical medicines. We can do counseling support. Not as to the extent of a registered therapist, but can definitely refer and things like that. But we can also provide nutritional support, dietary support as well.
Wonderful. Wow, that's a lot of variety of
Yes,
options that are out there to be able to draw upon.
exactly. And I'll add to that, actually, we have further education, further testing done so that we can prescribe bioidentical hormones. We can prescribe hormones like thyroid support, for example. And also we do a pharmaceutical exam so that we are knowledgeable about the common prescription medications that patients come in to see us with. And so we can see if there's any interactions in the drugs that they're prescribed, and if they would interact with some of the herbal medications that we would prescribe, so that patient safety is number one.
Absolutely. So I wanted to talk about maybe some of the common areas that people might come into you, and maybe talk about the typical treatment protocol that you would
Right.
have. So if someone came to you and they had heart disease, what would be your typical treatment protocol for them?
Right. So with heart disease, that we first would have to do a very thorough intake as to see the symptoms and how did it all begin. Because usually with heart disease, there's other symptoms, other conditions like blood pressure or possibly previous history of stroke. So really, my treatment plan is to get to the root of this. So addressing the blood pressure, for example, supporting the heart with necessary vitamins or supplements, or even herbs that can help with your heart health. But this really depends on the patient's history. So every patient, I treat them as a person, so that I want to individualize the treatment for them.
Right. And does that also include, if they come in with higher cholesterol, that falls
Yes.
into that heart
Exactly.
disease?
So
Okay.
high cholesterol, most patients even come in with diabetes. They would possibly have varicose veins as well, maybe some swelling in your lower legs. So those are all symptoms, possible symptoms of heart disease and complications of heart disease. So these are all things that I would address as well.
Okay. And if we looked at people that are coming in for menopausal or hormonal conditions,
Mhm.
what would you say your treatment protocol would look like?
So with I'll start with menopause, for example. So that's some of the most common symptoms would be, hot flashes. Maybe there might be some mood irregularities the patient's feeling. Maybe there's some weight fluctuations because there's all these hormones that are kind of declining or going up and down. So my treatment strategy there is to support the hormonal regulation using botanical medicine, using, once again, all the tools in my toolkit. Acupuncture can actually be really great for menopause as well. So really it is to manage those hormones. And of course, if I feel like it is, let's say, out of my scope, my main goal is patient safety. So I would, of course, refer to get further testing done, or even communicate with your family doctor to get additional medicine or whatever that you need.
And
Yes.
as we
Yeah.
consider digestive gut health
Mhm.
issues, and we think about, you seeing a patient with those, what
Right.
would you say that protocol would look like?
Right. So I actually see a lot of gut issues in my practice, and it really relates to a lot of the conditions that we see, because your gut is everything, and that's where your nutrients are absorbed. It's where your energy is determined, and you eat 3 or 2 times a day, so you're going to experience whatever the symptoms you have every single day. So with my treatment protocol is to first get a timeline of where your symptoms began. Was there any recent traveling that you did? Were you exposed to certain kind of pathogens? Is there previous family history of gut issues? Is there previous family history of colorectal cancer, for example? So all of these are important for me to kind of put the pieces of the puzzle together to see, okay, do you need just dietary support and lifestyle support, or do you need something a little bit stronger in terms of fixing up your gut? So this could be probiotics, this could be herbal medicine to kind of fix the lining of the gut. So there's so many things that really depends on the patient's story. And that's why we spend about an hour discussing the things with the patient, because it's really important to connect those dots.
Yeah, it sounds like it's a very individualized approach to
Exactly.
each person and each condition,
Yes.
because we all come with a variety of things.
Exactly. 100%.
Yeah. And so what types of conditions and patients would you love to see and serve in your practice?
I would love to see all different kinds, because I love the challenge and I love this. I'd love to make my patients feel better. Right now, I mean, I'm open to seeing, as I said, women's health, a lot of conditions like menopause, hot flashes, conditions of painful periods, trouble with, of course, digestive issues as well. So indigestion, bloating, weight loss, mood issues, so anxiety, trouble with managing your stress. Sleep, of course, is important too. Also, fatigue, like your energy levels can be huge, and skin conditions as well. So all of those are some of my most passionate topics.
Well, we'd love to have you, because you have joined Justine Blaney Wellness Center and partnered with us. But we're curious, how did you learn about Justine Blaney Wellness Center, and how did you choose to work here?
Right. So, funny story. I actually live very close to Justine Blaney Wellness Center, and I've for like about 15, 17 years. So I've always seen the clinic as I'm going to, college or university and education. And I had the opportunity to kind of shadow Dr. Justine when I was a student. And I really saw the positive energy and the vibrancy of the clinic. And that really attracted me to the clinic as well. And I know that Justine Blaney Wellness Center is really involved in the community, and that's something I wanted to do personally and just work there for that as well.
That's awesome. And so you really you were drawn in by the atmosphere and the teamwork that you saw?
Exactly. Yes.
So if you could share a little bit about what your hours are and approximately your fees, just so that everybody can get a perspective.
Right. So right now I am working at Justine Blaney Wellness Center on Wednesdays from 2 to 8, Fridays from 8 a.m. to 1 p.m., and Saturdays from 8 a.m. to 1 p.m. My hourly, or my rate is, for the initial visit, is $170, and then the follow-up visit is usually about 30 minutes long, and that's $90. So depending on how we feel with the first visit, if there's, I will be making up a plan, a treatment plan. So then we go from that. And of course, I'm not one of those doctors that is going to be like saying I'm not available on this time. So like I'm always available if my patient needs me, and I usually am very open to communication through email, through phone, whichever really makes my patient feel good.
That's amazing. Thank you
Thank
so much
you.
for sharing. It sounds like you're really open. Is there anything else that you would like patients to know about you, or your style and treatment, or your healthcare philosophy?
Big one. So one of the main reasons I came into naturopathic medicine was because, I saw how my mother got better. And then I really was impressed by the philosophy of, helping your body heal, help using through natural techniques, so that you're not prescribed 2 or 3 drugs, but, and it's so confusing for you. Your symptoms aren't really getting better. And while there's a way for you to really get better naturally. So what I really liked about it is that as a doctor, I can be a teacher, I can advocate for you, and I can really help you see the pathway to better health. So my philosophy is about individualizing my treatment to you. So whatever your story is, whatever your health symptoms are. It's my job to connect those dots and give you the treatment that fits you. So I don't just see you as a number. I see you as a patient. I see your story. And that is really my philosophy.
Yeah, and I know that you're very caring and compassionate in your approach to everybody, very
Yes.
approachable,
Thank
getting
you.
to know them and to getting to know them as kind of that person is so critically important with building trust and that connection with
I
and that
completely
relationship.
agree, yes. Because a lot of times patients actually come to see me and they say, I've been to this place, I've been to that place, and I really wasn't really treated as a person. I was just treated for my symptoms, and I felt like I wasn't heard. So something I really encourage is for my patients to really talk to me, and I'm there to listen to them because that's really important, I think, because a lot of times patients just don't feel like they're heard.
That's wonderful.
Yeah.
Dr.
Yeah.
Udani, is there anything else that you would love to share with the viewers?
Just about myself, I guess I'm a very young at heart person. I'm really passionate about healthy lifestyle, and I'm just a very optimistic person too. So something about myself. Yeah.
That's amazing. Well, we are so happy to have you on board
Oh,
as
thank
part of our
you.
medical team and, on people's journey to wellness. And I think that it is part of a whole team that comes
Yeah.
together. Everybody has a different area of expertise, but I think that everybody has comes with different needs and different dynamics, and I think that you are going to just work so well with us and with your patients. And we
Thank
wanted
you
to
so
thank
much.
you so much for being here today with us. I'm Angela Vollmer. I'm the marketing coordinator here, interviewing on behalf of Justine Blaney. And I wanted to thank you, Dr. Udani, for your time and your dedication to our community. Okay.
Thank you
Thank you
so much
so
for
much.
having me. Thank
You're
you.
welcome. Have a great day.
Thanks. Bye-bye.